Hi, this is Dr. David Greene, CEO of the Florida Pain Network, where we connect those in pain with pain providers around the state. Today the topic is a very exciting one in the world of regenerative medicine, and that is a new study looking at platelet-rich plasma injections for knee osteoarthritis. Now, multiple studies over the years have looked at platelet-rich plasma for medical fields such as cardiovascular, ophthalmology, urology, wound care, but it's only been the last few years that a lot of studies are coming out on PRP for musculoskeletal conditions such as tennis elbow, golfer's elbow, rotator cuff tendonitis, and the latest is looking at it for osteoarthritis. A study late last year out of Hospital for Special Surgery looked at 22 patients who received one injection of platelet-rich plasma into an arthritic knee. Now, a real quick aside on what PRP is. PRP is platelet-rich plasma. It involves taking a blood draw from the patient. So you take your own blood, just like a blood draw. They take a little bit out of the arm. Well, it's more than a little bit. It's 20 to 60 cc's of blood. It goes in these test tubes and it gets spun down in what's called a centrifuge machine really fast. And what it comes out in is 3 layers. And the top layer is what's used for the PRP. Okay, that's called platelet-rich plasma. In this study, they used 6 cc's and injected it into the arthritic knee. In 22 patients, 1 injection, and then they followed them for a year. They looked at pain reduction, function, such as activities of daily living, sporting activities, things like that. And they also looked at MRIs multiple times through the year to see whether there was cartilage loss during that year. Because most studies show that with an arthritic knee, patients lose between 4 and 6% of their cartilage, each year. So here were the outcomes. In this study, they showed that, pretty much across the board, pain levels dropped throughout the year. So that was effective, okay? Functional levels increased, and that was very effective. People were able to do more. They could do more recreational activities. Very significant there. And when they looked at the MRIs, what they showed is that about 3/4 of the patients had no change in their cartilage levels in the knee, okay? So you didn't have that 4 to 6% drop. You actually had no drop in 3 out of 4 patients. So very significant sounding results, but the study was not big enough to make huge statistical conclusions. So that's why they recommend a bigger study be made, and it will. This is called a pilot type study because it showed significance, but only in a small number of patients. They need to show statistical significance, right? So they have done studies before in cows looking at PRP injections for arthritis, and they showed that it did increase cartilage in the knee, and it also increased the amount of stem cells. Because what PRP does, it has platelets in it, which help with repair and regeneration of tissue, but it also has growth factors. And those call in stem cells, and they can help, the theory is repair some of the damage, okay? So this is very good news. It may help a lot with mild to moderate knee osteoarthritis. And it didn't matter where the arthritis was in the knee, between the kneecap and the femur, in either the inside or the outside compartment. They saw really good results, wherever the arthritis was. The average age was 55. In the study, it went from 30 to 70. So it didn't look at end-stage arthritis. It looked at, painful arthritis that was either mild, moderate in nature. All right? So very exciting. Check out FloridaPainNetwork.com. Lots of educational information on the site. If you click on I Need a Pain Doctor or the Pain Management tab at the top, just put your zip code in. It'll show you those that are closest to you. All right? Or you can call us at the number listed on the screen. I'm Dr. David Greene, CEO of the Florida Pain Network. Your pain stops here.